record on the computer.
Yeah.
Amazing. I'm going to drop that down. I like being on this side of the screen. I don't like how on Facebook it's flipping us.
Yes, it's very
I'd actually rather
confusing.
watch this.
Yeah. Okay.
Maybe I'll make our faces smaller here.
Yeah.
Just two talking heads. Make ourselves smaller on that side. Oh, I can't.
This is exciting. It's actually working. We're doing it.
Yeah. For those of you who don't know, I never go live on Facebook. I always go live through Zoom just because it's an easier platform for me to understand. So we are just tackling this as we go. So what I will say is I'm going to drop this down actually, just so that we can have a conversation in there. And then I will open this and check to see if we ever have comments coming through.
Oh, nice. Yes. The comments
and questions
and notes.
Well, I hope there's like a cut bar that I can do this when I go to record it, but
ready?
Welcome everyone.
Hey.
We're going to have a discussion today. Me, Dr. J, and Dr. Catherine, we're going to talk about postpartum anxiety and depression. We've had a lot of interest that has, I want to say stimulated the conversation around this. I think it is a condition, both postpartum anxiety and depression, that a lot of people go through, but it's going unnoticed. And mainly that's because, as women, when we give birth, a lot of people say that's normal, or, oh, I'm stressed out, or I'm having thoughts about this, or, I'm losing sleep. And people are coming back and saying, yeah, like, welcome to being a mom.
Or they're not talking about it.
Yeah. So we're going to dive deep into some of those concepts today. We both have some notes in front of us so that we are making sure we cover everything that we need to. But I just wanted to welcome you formally to our chat.
Hello.
It's going to be very chill.
Yeah.
Usually I have Dr. Catherine on the screen. So when I'm talking to her, I can see her in front of me. So it's easier to have the conversation, and I'm not going to be doing this close talking situation because that's weird. So I am just going to talk to you through the screen. Okay. So like, if you feel like I'm going to address you through the screen.
Yeah, that's fine.
All right. I'm going to pop in and see if we have any questions coming through. If you are joining, give us a hello. If you have any questions that you want us to cover, add them in now so that we can at least look back and answer those questions. Okay. So
let's do this.
The first thing we are going to be covering today is what is happening hormonally after pregnancy. So after we give birth, and we're going to talk about the parallel between what happens after we give birth inside our female bodies. And then we're going to talk about there's some crossover to other hormonal conditions. Okay. So I'm going to pass it off to you right off the hop. I just looked at you. I said I wasn't going to do that. But okay. I'm going to get you to talk about what's happening with progesterone and estrogen after pregnancy so that everyone's understanding what's happening with the rise and the drop and how that's going to relate to other mental health hormones, as we like to call them. Otis has to go to the washroom so badly.
Okay, so let him out.
Okay.
We'll start talking.
Yeah.
Okay. So naturally, when you're pregnant, your hormones start to rise to make sure that the baby, is growing properly and it has what it needs. So your estrogen is going to rise slowly, and so is your progesterone. And what happens is the placenta takes over the progesterone secretion, or it starts to start secreting the progesterone. And so that when you give birth, there's going to be a really significant drop in those hormones because the placenta has left your body. So you don't have that source of progesterone being secreted. Is there another word for secretion? I feel like it's just such a gross word.
Mucus.
Yeah.
Moist.
Fluid. Anyway, that's
released,
the only word.
Released.
Thank you. So the placenta is the main releaser and producer of progesterone. So when you give birth, that source is gone essentially. And so you have this drop in hormones. And it's a really big, crazy event. And so that drop is naturally going to happen anyways. And that's going to be part of why women get naturally those baby blues. Mm-hmm. It's kind of the same thing that's happening when you get your period. So, 2 to 3 days before your period, your hormones are going to start to tank naturally. And that's what causes those feelings of PMS, that little bit of sadness, the weepiness, the mood swings. You can get a little bit of anger, frustration in there, irritability, same thing. But when you give birth, that's like on steroids. It's like 1,000 times more dramatic. because it's just such a significant drop. So that's essentially what's happening with your estrogen and progesterone. You're also going to get some variations in your thyroid hormone, also cortisol. You're running on some adrenaline because it's such a big event. If you go through surgery or you have a traumatic birth or complications or things that you didn't even expect, then you're also going to get, you know, these fluctuations or these increases in stress hormones. So essentially that is what's going on in a nutshell.
Now, I think right off the hop here, it's important to talk about what the difference is between baby blues and postpartum anxiety and depression, because baby blues, what you just mentioned before, are legitimately normal, right? Yes. When you're going to have a drop off of progesterone and estrogen, you are going to have symptoms regardless. It doesn't matter if you are the most mentally well or the most mentally unwell person, you are going to have the baby blues just by function of being a human being who just birthed an actual human being. Mm-hmm. Okay. Now the difference is that baby blues is supposed to last that 10 days to 3 weeks period. Did you already mention that?
Nope.
Okay. And then the postpartum anxiety and depression is going to be past that 6-week mark. So if you have given birth, you know that you're going back in for that checkup at 6 weeks to make sure everything is functioning well down there. But then after that, that's when they can start to assess mood. And I would say that mental health component of, am I having anxiety symptoms? Am I having depressive symptoms? Am I having OCD symptoms? These things are going to start to come out from, I feel whacked because of my baby and giving birth, to I now have pathological, I have pathological thought processes that are indicative of a diagnosis. I am going to go get my dog so he stops barking. Okay. And you know, what we can do from here, just while I go get him, is we can talk about how just because everyone goes through that hormonal change, it doesn't mean that everyone is going to get anxiety and depression, because there is a difference. And we're going to talk about that crossover.
Yes. Also, a couple things to mention that I didn't mention in the hormonal part are the increase in oxytocin and prolactin. So that is something we can touch on a little bit later too when it comes to PPD. But wait, what were we going to talk about again?
I'll bring it back up again. Okay. Otis is back, guys. If anyone wants to see Otis, raise a hand. Okay. My dog loves showing up on camera. So just because we are all going through this hormonal drop of progesterone and estrogen after giving birth, it doesn't mean that everyone is going to have symptoms, right? So this isn't like, oh, you know, just because you've had anxiety in the past, you're now going to get anxious because you've had this hormone drop and it's going to happen. So there is the genetic vulnerability to getting these conditions. And let's cover a few of those things now, because it's very important to talk about at the start. So if you do have a history of generalized anxiety disorder, of course, your vulnerability is going to be increased when you are having this. It's a life event. It's like stress, not just cortisol, like you mentioned. Like literally every neurotransmitter that you have is on frickin' fuego. Okay. Yeah. So that is going to make you more vulnerable if you've had anxiety in the past, if you've had depressive episodes in the past. Yeah. You are going to be more vulnerable to having postpartum depression. And again, I know it's sounding right now like we are saying it's all hormone related and it's all neurotransmitter related, but it's not. The way that our brains perceive stress and the way our bodies perceive stress is different than a normal person who has no mental health issues. Okay. We are going to have a easier slip and slide down into the land of having anxiety and depression at a life event, you know, whether that be birth, whether that be the death of someone, whether that be, you know, a breakup, all of these things, it makes us more vulnerable to having our symptoms pop out at those times because of how we perceive the world around us. Okay. So that is something we want to take into account, which is why I said, even if you're not pregnant, or even if you haven't given birth to a baby yet, and you do have anxiety and depression, it's something you want to pay attention to now, so that by the time you get to this type of life event, that you are at least putting the plan in place that's required, so that you have less of a probability of getting there. And that's something that always was at the forefront of my mind, which is, if I've had so many depressive episodes in my life, imagine how much more stressful it is to go through a pregnancy, give birth to a baby, and actually do that, and then start to experience how your life changes after. Like that is going to probably throw me into a place where I feel less mentally stable. So I always wanted to look into see, you know, how much can I heal before that point, or how much of a handle can I get on this before I get to a point where it is out of my control? Because I can fight what's happening up here, but like fighting what's happening inside your body and like hormonally, that plane that changes. I don't think that any of us are really well equipped enough to just, get through it. If we just, put our big girl pants on, it's definitely, you have to put things in place to make sure that you are functioning well before you get there. So we have that anxiety and depression history that's going to make us more vulnerable. We also have people who have PMS and PMDD. If you don't know what that is like PMS again on steroids. You are going to be more vulnerable to having postpartum experiences with mental health because you personally are more sensitive to your female hormones. Okay. This is kind of how I can say men go through mental health issues as well. And they have a specific subtype, hormonally, what could be happening there. Women have a different one as well. We can have straight up, anxiety, depression happening here. But when you start to mix your female hormones in there, they're just because it's
amen, sister.
It's a shit show.
Oh, God damn it. It's so true.
So yeah, so we have PMDD, PMS, those can predispose you, anxiety, depression. And then we have nutrient deficiencies, which you brought up this morning. Yes. So I do want you to talk about that and how the nutrient deficiency of, I think we spoke about iron and magnesium. We'll talk about those, but do iron first because that is very relevant as a female, we bleed. But we want to look at iron both as, in pregnancy and then iron post-pregnancy. So go ahead.
Yeah.
Speak away.
Women in general are more susceptible to be deficient or low in iron because we bleed every month. If you have a heavier period, then you are more likely or at higher risk of being more deficient. And if you get pregnant and you're not addressing that deficiency or you're not properly repleting your iron in pregnancy, then you're going to be even at a higher risk of being iron deficient. And what happens is what is the stat? It says women who are low in iron in their pregnancy are more susceptible to have postpartum depression.
I think the number was 25% this morning that you said.
Yes. So there was one study, I'm going to read the stat. Iron treatment resulted in a 25% improvement in a woman's or a mother's depression and anxiety levels in those who were previously deficient. So meaning they're deficient in pregnancy. So that's why iron is really, really important to make sure that you're properly supplementing, you're properly getting it from your nutrition, eating red meat, all those things, foods high in iron, to make sure that you are properly repleted and you're reducing that risk of having postpartum depression. So it's like these little things that you can do to mitigate the severity or the risk of actually having PPD. So iron is a big one.
Let's talk about the symptoms that you get from an iron deficiency. So like the fatigue, that's going to be, if you're having like severe iron deficiency, you're going to be feeling that sensation of no motivation to get up, brain fog all the time.
Yes.
Waking up with heart palpitations in the middle of the night.
Anytime. Heart palpitations anytime.
So there's a big crossover between anxiety and depression with that nutrient deficiency. And if you've heard me talk live before, I've mentioned iron just in general, regardless of pregnancy. But it is going to play a big role here because, again, imagine you spend an entire pregnancy, your blood volume is changing, which you mentioned earlier. You are now needing a higher requirement of iron in order to feed all the things that are now living inside you. And then you give birth, which is, I don't know if you know this, guys, but it's a bloody experience.
It's pretty bloody.
So
not to mention, if you do have to go through surgery or have a C-section, even more bloody.
Yeah. And in the 6 weeks after, you're like legitimately still bleeding as your uterus is healing.
That's a good point.
So if you don't talk about blood, maybe you should exit the live now. But that is definitely an important thing that you need to remember is like, if you're not supplementing with iron after and you're having symptoms, like frank symptoms, just get it done, right? Get the blood work done. And I cannot stress this enough. Just because your iron levels are within reference range of what the labs say, that doesn't mean that they are at an optimal range, not only for your body, but for you as a female. Okay. Like I have seen people and patients come to me being like, well, my iron was at 8, so it's in range. So like, why do I need to supplement? And I look at them and I'm like, I'm going to pass away now, right? So we don't we don't want to see levels that low, except it not showing up on blood work and you being like, okay, we're good, let's go. We have to look into it and make sure that we are functioning properly with the numbers that we have. I read recently that you want your numbers to be around 40, right? So if you've done your lab work and you're sitting at a 20 and you're like, why don't I have energy to do this and like my baby? It's like, well, let's get all of the obstacles out of the way first before we go diagnosing ourselves as crazy, or like an unfit mother without having proper iron levels.
And remember, it's like a really significant drop too. Like, it's not just your iron stores get depleted over a long period of time. It's a significant drop. So it's just important to keep consistent with that. So another vitamin would be vitamin D, really important to be making sure you're getting enough of in general, any time of your life. Vitamin D helps support your immune system. And sometimes during pregnancy, the thyroid can act up and it can cause antibodies and things that kind of work against the immune system. So if you can help support your immune system, make sure that's functioning. And then also just making sure vitamin D is there to reduce inflammation, support your mood, all those things, then it's definitely a top nutrient to be looking out for.
Now, without you all listening right now, having the background of like science and physiology in your brain, is there a way that we can connect the dots between vitamin D, the thyroid, and symptoms of anxiety and depression? Because we're going to try and have a very, very quick science lesson. Okay. When you have your thyroid is, it is functioning with all of the other things in your body, but it has a strong hormonal component. So when we talk about hormones, we can't ignore the thyroid hormones because they're all dancing together: the female hormones, the thyroid hormones, mental health hormones, stress hormones, all that kind of stuff. Right. So when we have low vitamin D, we start to have thyroid dysregulation, which can present as hyper or hypothyroid, which can present as anxiety or depression. Okay. So we do want to
low energy, the energy.
So we do want to make sure, again, when we do proper lab work and look at those results, that we are not diagnosing ourselves with postpartum anxiety or postpartum depression when it could be something else physiologically that's happening. But at the same time, these thyroid levels can directly impact your vulnerability to getting these conditions. Welcome to the shit show. Okay. Am I even allowed to swear on Facebook? I swear in my Zooms, but I don't know if I'm allowed on Facebook. I'm probably not allowed. Whatever.
We can beep it out.
No,
we can't.
Me.
It's
Facebook.
live.
Facebook, don't cancel me. Okay. That would just be a terrible thing to do.
Also to note, it is really important to know that the thyroid acts up during pregnancy. Regardless, it can go on its, all these different swinging crazy patterns. So it's really important to, if you're noticing your energy really low or really high, like if your energy is low, you're fatigued, you're gaining weight, you're constipated, your skin's really super dry, or if your energy is super high, you're like more hyperactive, you're losing a ton of weight really quickly. It's important to get your thyroid checked just to make sure that it's not out of control.
I just thought about how interesting that is. Like, imagine you're breastfeeding, you just gave birth and you're like losing weight really quick because your body's like turning over the hormones and you're breastfeeding and whatever. And then you're like, sweet, I'm losing all this weight. And you like, don't realize that your thyroid's like raging.
Yes.
Yeah.
It's a problem, or you can't lose the weight because the weight just keeps coming on, even though you're breastfeeding. So it's really important to take a look at that because it's very, very common. And it's also common to see your thyroid conk out a year after pregnancy. And so I typically see a lot of women who have secondary infertility, and that just means that they can't get pregnant after they had a first pregnancy or a first child. It's hard for them to get pregnant a second time or a third time. And that a lot of the times it's because their thyroid is out of whack.
So it's not being regulated between post-pregnancy and their next one.
Yes. And women, it's just going unnoticed. So women are like, oh my God, I'm so tired. I don't know what's going on. And they just think it's because they're taking care of a child and pregnant, post-pregnancy time is crazy. But it could also be their thyroid is out of whack and it's, contributing to these symptoms. So Thyroid is important. Don't forget about your thyroid.
That was a really good segue into like the next topic of sleep, because like, yeah.
Mhm.
I do want to check to see if there's, any questions, because I have a different screen popped up because Facebook inverts our faces and I can't handle watching myself be on the opposite side of the screen and
It's
also
weird.
having a face that's not the same shape.
Yeah.
Which I don't know if you guys see me differently, but you guys have seen the inverted filter on TikTok and like, the horrors of whatever that is. Okay. So let's segue to sleep right now. Because again, I think it's this very normalized thing where people are like, yes, you are not going to be sleeping well after you give birth, and you are either on a new schedule or you are a slave to this baby who's attached to your tot. And I think that people do not focus on regulating their sleep, and it's almost like the beginning of a mother letting go of her own needs and desires for a small creature.
Totally.
But like you have to sleep, and you're going to have to put some lovely effort into not just sleeping through the night, because sometimes that's legitimately an impossibility, with whatever the baby's schedule is, whatever support you have at home, whatever the business is. But there has to be some effort put into that, past the few weeks of you finding out what your schedule is, even though it's in flux. But we do need to regulate sleep, because melatonin and cortisol are the sleep regulating hormones, sleep wake cycle. And these are going to have a direct impact, not only on your female hormones, which are going to make you feel more out of whack and more anxious and more depressed. But at the same time, if your cortisol is not being regulated and you don't produce any melatonin, you are on a very quick road to
Exacerbation.
dismay.
Yes.
Do you know what that word means? I don't even know where that was logged in my brain that I just said that.
It came out.
Yeah, it came out fast. So sleep, it's going to have a huge relation to postpartum anxiety and postpartum depression presentation. You might be doing fine for 3 to 4 to 5 weeks, 6 weeks, running on the fumes of whatever, cortisol you got left in your body. And also your mom brain is raging and you're like, gotta do this, gotta do that. You can only last on those fumes in like your resistance phase for so long until you go and like drop off into complete fatigue, complete dissociation, lack of desire, just like
all the crazy.
Yeah, that. Or we are running, and now we're like manic.
Yeah.
In like the anxiety phase of, I need to have control over everything. I need to do this. There's just something so fascinating after giving birth that can make you tick. And it makes your nervous system tick, and it can change you forever. And that's not a change you in a forever bad way. Dun, dun, dun. This is the end of your life. No, it can change the way that you process information. And we have to intervene in order to get a handle on this before all of those new neural pathways are solidifying themselves, because you don't want to go from like being chill to then being a neurotic mom. Like that's not a fun place to be.
No, it's exhausting.
Yeah. And it's also like not cool. Like a lot of the, the high achievers that I work with, and a lot of you in here that will listen to this live, you pride yourselves on being someone who can handle everything. And you're like, I'm chill, I got this. And then suddenly you're like, I don't know who I am anymore. And like, you're crying all over the place and you're thinking about all these things that you never thought about before. And
okay. But which is also normal in that period of time.
Yes.
Like your life has changed significantly. So your hormones are crazy. They're raging. Everything is out of control. Your whole life is basically flipped upside down. But that's normal. And it's okay to be feeling these feelings. It's just when they go on for too long, past that month phase, that's when you need to start getting curious about what is actually going on.
I liked that word. Get curious after the 6-week phase. Yes. Do not freak out if after 6 weeks you're like, oh, I'm not back to normal. You don't have to have like a mental freak out about it. But I would say if you're looking at the 3-month mark and you are not sleeping, if you are looking at the 6-month mark and you have no desire to engage with your child, these are some things that you're going to want to start looking at. Let's talk about red flags now. That was a good segue.
About to say, let's talk about those. We are on fire today.
Are we though?
Yes.
So not able to sleep, we just said, that's going to be one. Endless crying.
Yes.
So like not
your baby, you.
Your baby will cry. No, not knowing why you're not stopping, right? Like if you just feel the incessant need, which again, I've spoken to so many of you, and I know you feel the incessant need to cry even when you don't have a baby or have never given birth, but this is, it'll feel, it'll, you're going to be looking at yourself being like, why am I crying? Like you don't know, right? It's a physiological need and desire to get out the emotion and the cortisol. And that is definitely not normal. Okay. You can't just be walking around weeping.
And this is past the
baby
3 to
blues.
4 month time frame. So it's totally normal to be crying randomly during that 3-week period, 2-week period, whatever. But past that is when you have to start looking into it and getting curious. And
yeah. Now, this one's obviously going to be a little bit of a trigger warning for some of you. If you are having intrusive thoughts about harming yourself or harming your baby, most of you are not going to think twice. You're going to be like, holy shit, this is scary. I just work it. No. But now I have to do something about it. Okay. These intrusive thoughts, they are not as abnormal as you think.
Yes.
So the most encouraging thing that I could ever possibly say to you is reach out to someone and tell them, so that you can have a safeguard put in place, right? This isn't me saying you are not trustworthy and you are not to be trusted with your baby. But if you're having these intrusive thoughts, it's not going to make you feel very comforted. And it is going to cause more anxiety and more depression because you're going to feel like a bad mom and you're going to feel like you're scared of yourself. These things are actually very common intrusive thoughts. So normal. It's something that you want to reach out to and talk to someone who you feel is going to, take that in without judgment. Right. Yeah. I think a lot of moms, when they have those intrusive thoughts, are like, I can't tell the doctor because then they're going to like call child services on me or take my child away. And it's not like that. There's something physiological going on. Yep. And there are ways to work on it, but you just have to be willing to take that first step and say, okay, I recognize this isn't normal. This isn't me. And now I'm going to put the things in place that I need to in order to keep myself and my baby safe. Right.
And I also want to mention too, even if you're not suffering from postpartum depression or postpartum anxiety, these intrusive thoughts can be normal as well. So don't, beat yourself up over that. It's just, it's like having anxiety is like your body just giving you like a little bit of a warning sign, like, hey, this is something to look into, pay some attention here. It doesn't mean that you have to
don't pay too much attention.
Right. Like, let's say you're giving your baby a bath and you have, this violent thought of something happening.
Yeah.
It doesn't mean that that is going to happen or that you are going to act on that. It just means that it's your body saying, like, your mind saying like, hey, be careful here. You're giving this little baby a bath. So pay attention. Yeah. But it doesn't mean that you have to, look even further into that thought. It's only when those thoughts start to become, debilitating, you start thinking about acting on them. You would think that your life would be better without the baby in your life. That's when you need to reach out and talk to someone about that.
Yeah. Mm-hmm. Sheesh. Yeah. I hate to segue because I really did want to talk about maternal rage, and it makes me giggle because like there's some people, and if you are listening and you're like, that might be me, who you just don't have emotional regulation. Like anything will make you snap and scream and like rage. Mm-hmm. That is that flicking point between I am neutral to I am now raging. That is your nervous system being very dysregulated. And I've talked about this before in a live. I call it sensory overload. And the sensory overload as a mom who has just given birth and is in postpartum phase, I can imagine that your sensory overload is for two, right? You are now dealing with your own storm of whatever's happening inside. You have a baby crying. You are constantly trying to have tactile engagement with your child, which for a lot of people with anxiety and depression is sometimes overwhelming, but you can't not give into the need of your child. So this is battle of like, who do I take care of me or do I take care of you? Because I obviously have to take care of you. And then we come up against, I guess the right word is like mom guilt, to the point where you can snap. Right. So if you are emotionally dysregulated as a regular anxious and depressed individual, I am going to urge you and encourage you and recommend that you learn how to regulate your emotions or find out what it is that you need to do to make that sensory overload go away before you end up in that position. And this isn't one of those things where like, oh, you won't know till you know. Like, no, you know, if you're a snapper, you're going to have to figure out what it is that you need in order to make sure that that rage doesn't come out past like maybe a yell, because the hormonal overload, both with your stress hormones and your female hormones, can sometimes land you in a position that you didn't think you would end up in. Smacking someone across the face, punching a hole in the wall. Like, you don't know what your body is going to do when you are that overloaded. And you think to yourself now, well, I have been stressed before. I know what that's like. I know what it feels like to snap at someone, like whatever. You don't know. Right. Yeah. Like, I can imagine, and I know I'm live on Facebook and I know my husband's in this group, so God help him, but I can imagine one day that I might just smack him over the head because the sensory overload is just too much. Right. If there was, I already deal with it myself. I can imagine if there was a small little baby here and that bothered me. I think that I can understand how one would be inclined to by accident go there. So that is something you want to keep in check. And like, that's where the lifestyle interventions are going to prove very, very effective for you when it comes to managing your anxiety and depression outside of the baby isms.
Yes.
Okay. So we covered all those red flags.
So we said excessive hopelessness, excessive crying, insomnia, the rage, the thoughts of self-harm or harming the baby.
I just wrote down something I want to talk about. And I think it's a patient that it's either a patient that we saw when we were in clinic a bunch of years ago, or it was someone who I've spoken to as a patient in the past, and I can't remember. But it was about someone not engaging with their child, or like not wanting to play with them, not wanting to pick them up when they're, not when they're crying, just not having the desire. And it can be misconstrued as like, is that pathological, or is there just like an innate selfishness of like, I need to do me right now and I choose me? So like, where do we cross that line of, not, I'm pondering now. Are you pondering?
Yeah. So I think it's that connection piece. If you're not feeling connected to your baby and you're not feeling that bond there, you can still feel connected to your child and need self-care or need to take a shower or need to eat and let them, put them in the crib and let them do their thing. But I think the point comes to like, is it bordering on neglect? Are you wishing that the child wasn't there so that you could, feel some relief? Is
that bad though? Or is that like a normal mom feeling? I wish some moms could pipe up right now and be like,
it's a normal mom feeling.
We'll get there later. Sorry, I was just checking the question.
I think it's a normal mom feeling, but it's more like you don't snap out of that thought of like, oh, I wish my baby wasn't here anymore, so I could just live my old life.
Yeah. So you have the thought, but then the desire is, well, I have to do it anyway.
Yeah.
And then you go and you do what you need
to do. I love
my
baby. I feel that connection.
Yeah.
But sometimes I wish she wasn't here.
Yeah.
Versus like,
right. And I guess where it becomes pathological is that biologically, when you give birth to a creature, as a human, at least, or like mammals, because I can't really speak to other animals, but you want to connect and care for, and give to your child. Now here's an interesting thing I'm going to flip on its head. What if you are a mom, and you have mental health struggles? What if you have a personality disorder that predisposes you to feeling less empathy, predisposes you to feeling, having more impulsive feelings and feelings of selfishness? Not that it's bad, but we do have personality types that it's like me first. And even though there's that biological hormonal plane, and when I say plane, I'm talking about landscape in the body, like a plane, the hormonal landscape of now I must give to another. I do wonder how those two play together. Like,
I would imagine it'd be much harder.
Wow. This is like a deeper conversation we could have about like narcissistic mothers or something.
Or borderline.
Yeah,
totally. Very interesting.
Not that those two have any relation. No, we were just bopping around ideas there.
Yes.
That was a bad like segue slip for our perspective.
Right.
But Yeah, I do wonder how that would play a role. And you know, when I work with my patients, if someone brings that to me, you know, there, I want to talk about the part that should be normalized and is like, yeah, that's totally a normal feeling. And then, hey, that's actually pathological, and not that that's bad and you're a bad parent, but we can work on that deficiency so that, you know, you can build connection, or that you can, at least in some instances, you have to actually fake things and manipulate things around yourself so that you are being the person that you want to be. And I think that there's just a big discrepancy there of like innate feeling. Sometimes your innate feelings are not always there, and you have to like go out of your way to build it.
Yeah, totally. I was going to say something and I can't remember what it was, but it was along those lines of, I guess you just have to like start becoming like more aware of yourself and your tendencies and your habits and your patterns, so that you know how to build a system and a support system and a group of people and strategies around yourself, so that you know what you need to get yourself through that period of time. You know, to see when things are starting to slip, when you're, you know, needing that extra support and help, so that you can take those steps instead of feeling bogged down and, you know, just getting deeper, further into a deep, dark hole.
Yeah.
So
it's such a vulnerable period of time, because like again, the hormones are out of whack. You are tired.
It's a huge shift
you're taking on like a bajillion more responsibilities.
And we haven't even touched on like traumatic births, complications, not having your pregnancy or your birth story look the way you wanted it to. Like you were talking earlier today, like what was the stat on the breastfeeding?
Yeah, there was a statistic I read today that was like, if you planned on breastfeeding and then you didn't get to breastfeed your child, the data surrounding getting postpartum anxiety and depression is like way higher. And that's where, again, does it have to do with the hormonal component of not being able to release those hormones for longer, or is it related to you genuinely just having that life stress and perception of this is so bad and like I can't get through that and I can't let go of that, like that rigidity in anxiety and depression. And I guess that's really the main takeaway today, is there's such a dance between nature versus nurture on all of these things. We can't just blame hormones for, you know, being a woman and having hormones drop, and we can't blame anxiety and depression for having all these issues and like not being able to tolerate life. There's this so many dance. There's like this fine dance between the two. So I think that is, let's segue to breastfeeding now, because we were having this debate earlier, not like a debate we were fighting. We were having a debate and trying to come to a consensus and understanding around the hormones of breastfeeding, and if they change the presentation of the anxiety and the depression based solely on hormones. Like if you're breastfeeding, you have prolactin, you have oxytocin, you are everything is just a little bit shifted. So it's helping you care for your child,
connect and bond.
But at the same time, there's like the lack of autonomy. So it's like, I'm not my own person. I don't get to do the things I want to do. There's probably a lot of less self-care happening during that time. Then there's like societal pressures of how long do I do this for? What if my baby's not eating it properly? What if I'm the cause of my baby not growing properly? There's just like so much. And we were trying to, you know, discuss if breastfeeding protects you from that vulnerability, because if you are someone with anxiety and depression now and you're going to have a baby, or you're pregnant now and you know you have anxiety, depression, and you're having that baby, is it better physiologically to breastfeed, or is it better to not? I think at the end of the day, it's actually just whatever feels right for you.
Yeah, I agree.
There's like not enough science to say, you know, this is better and this is not. And I think a lot of people will say that there are research studies to prove that, but like they're all going to be equal on both sides, being like, doesn't matter, you know, you have to do what's good for your quality of life and good for your baby.
Yeah. I feel like I'm done stigmatizing like women on making like the choices they feel like they need to make for themselves. Like if you can't breastfeed, or you don't want to breastfeed, or it's just not working, then don't breastfeed.
Yeah, I don't think it's making your life better or your baby's life better. Like we have a lot of technology now where your baby is going to be just as well fed and just as well grown, and the allergies are going to be the same and everything's going to go down. Your kid's going to love you just as much if you gave it, you know, formula. I don't think that we have enough concrete evidence to say that if you do things in the right way or the most natural way, that everything's going to go better.
Yeah.
And that we also had another debate today about if you have anxiety and depression and you have the vulnerability to postpartum, do we try and do natural birth versus, chemically induced birth?
Yeah.
Right. Because we don't know the answer to this question. And I don't think that there's going to be research to really go at this well enough. But I always conceptualized in my brain that if I was chemically induced, that I wouldn't be able to produce the proper hormones post birth to bond with my child. And it would predispose me to more anxiety and depression.
Yeah, I guess it would be interesting to know like the half-life of those drugs and like how long they stay in your body, right?
Yeah, and how similar they are in composition. And I mean, I'm sure there's research out there that shows
it's not just that like you give birth and then that's when you bond.
Right.
Like you're going to be bonding with your child for the rest of its life.
Yeah.
So there are plenty of opportunities to create that.
Yeah,
bond.
but like nervous system bonding. I also do wonder again that nature versus nurture component, which is let's say you want the natural birth because you want the proper hormones in your body cycling and doing the positive feedback loop, and you want that bonding, and you want that skin to skin and all that kind of stuff that happens after, but that's actually a traumatic birth experience at the same time. So I wonder if like which one's stronger? Like is it the chemicals that are produced in your body? Are they overriding the bad experience?
What is your mind saying?
Yeah.
Like what kind of mindset do you have around all this?
Yeah. It's just very fascinating. And we can't just like put a finger on it and be like, this is the proper way to give birth. And this is the proper way to raise your child. Because everyone's body is going to have different experiences.
Yeah.
Like some people are going to have different hormonal drop off, right? Just based on how their bodies process progesterone and estrogen. So we can't just be like, oh, you have this, which means you have this, which means you have this, which means you have this. That's why I'm like not a fan, even though we're in natural medicine.
Yeah.
I think it's like really tough for people to be like, oh, I'm doing individualized medicine. And I did like a blood test on myself that shows me how I process all these things. And that means that's how I need to do that. And it's like, there's just too much equivalence between what's happening in here and like what's happening here
and out here.
Yeah.
Like what is your partner doing? What is your family doing? What does your support system look like? How are you financially? Like all these things bring in factors into how you're going to, manage the postpartum period and how it's going to affect your anxiety and depression. And it's always going to be like different. It's going to be a moving target. It's going to be a roller coaster of like, oh my God, this is crazy. This is shit.
This is fine.
And it's just going to be this like constant moving. And I think it just always comes down to like, how are you going to support yourself through this whole period?
I want to try and see if I can answer this question here.
Okay.
Okay. Give us one moment while we read. Okay. Yeah. I also, this is bringing up something good about paranoia. So like, Caitlin's giving us a little bit of, what happened during her pregnancy, a little bit of like trauma that happened near the end. And now, and the pandemic.
Yeah, we didn't talk about what. We didn't talk about what.
And I'm so paranoid about anyone in my house catching anything. Yeah, I would say let's talk about the crossover with OCD. Hold on, we have another question here. What is sleep? 3 weeks. I also have an 8-year-old and a 1-year-old.
Oh my gosh.
Well, hopefully, Caitlin, we can talk about how to improve sleep, because if there are ways to fudge the system to get it snap back into shape. So we can talk about that if you do want to after. Laura's coming through with a haha, I understand all this. Yes, you are not insane. How do you regulate? Let's have a conversation about it. I feel like I'm talking right now like I'm manic because none of you guys can see the comments that I'm reading.
Take a freaking breath, dude.
I miss my kids when they're not with me, but then I'm stressed when they're around. Hello, sensory overload.
Normal. So normal.
Oh, Caitlin, this. Sup, Tyler. All right. So okay, what can I wanted to cover the OCD thing, okay? Because like there is something that happens, like it's almost like a higher ratio or a higher statistic that women who have anxiety give birth and then flip into OCD.
Yeah,
okay.
So interesting.
And like, I wonder if it starts with the nesting component of like being pregnant and you like starting to do that thing where like everything's now particular and everything's going in a certain way. But like people who have that high anxiety component have this thing where they just get OCD.
I think it's a coping mechanism.
Yeah. Finding comfort in control.
Yes.
You're like, my life is out of control and must find control. And intrusive
Yeah.
thoughts are a huge component of OCD. So never write that off. An OCD diagnosis is like very, very common post-pregnancy. And you might start to have new tics that you never had before. And I would, again, urge you, recommend and encourage, I've used those words in succession multiple times today, to work on those before those neural pathways get solidified again. Because we don't want to get into a pattern where we start to think, oh, that went well, or that happened in a good way because I did this thing. Because then you are going to start to spiral down a pattern of intense control and OCD twitches that you need to engage with. And there is this life event, and the stress of giving birth and being pregnant and all that really makes you more vulnerable to the word of the day today is vulnerable. It makes you really vulnerable to fall into those patterns, and like you get stuck in a loop inside your head. And that's like the definition of OCD. You're stuck in a loop inside your head. So I do want to talk about treatment because we've been live now for quite a bit, and I want to talk about what we can do post-pregnancy to help with symptoms of anxiety, depression, OCD, whatever. And
so many things.
Yeah, I want to talk about treatment if we're breastfeeding, if we are not breastfeeding. I want to talk about, we're going to talk about research. And we're going to talk about the research of plant medicines and why it is so subpar, because for some reason, in pregnancy and post-pregnancy, while you're breastfeeding, you are allowed to be on like multiple mental health medications like SSRIs, anti-anxiety medications. You're allowed to be on all of this stuff. But then if you do a quick Google search, like, can I drink chamomile tea? It'll be like, oh, be cautious.
It is
right.
Scary.
It's like, so we do have to find that balance and strike it between, you know, and I talk about this with my patients all the time. They'll be like, can I be on this medication because I'm getting pregnant? I'm like, yeah, like there's enough research on it to say it's going to be fine. Well, like, what about this plant medicine? Do I have to come off of it because it has like estrogenic activity? I'm like, well, no. Like, yeah, there's going to be no research that says it's going to be safe, because who is going to do a clinical research study and put someone who's pregnant or breastfeeding on a plant medicine and say, let's find out what happens to your baby? Talk about unethical, right?
And no money in that.
Yeah. Now, the only reason that we have all of this wonderful information about pharmaceutical medications is because literally 50% of the population is on it. So what happens is we do observational studies. These people stay on their meds because mental health of the mom is more important than, you know, anything else, because we need the baby to build, function, thrive, whatever. We have to stay on those meds because we don't want to be in another place.
Yep.
And people stay on them and then their babies end up fine. So we have lots of observational research on people being on pharmaceuticals, but like for plant medicine, sometimes everything's like spooky. It's like, ooh, we don't want to be on that because it might affect its big toe. It's like, no, we have to like really understand that these things are working in very similar pathways.
Yes.
And that bodies can process plant medicines the same way that they're processing, you know, the Tylenol that you just took. And
we can look into history.
Yeah.
Like these plant medicines have been used for thousands of years, right?
Yeah.
And there's historical evidence there. So yeah, that's also important.
So let's talk about, what do we do first? Can
we talk about the general things before plant medicine that people can do?
Yeah. Lifestyle things.
Yes. Okay.
We're just going to leave you on the edge of your seat.
Damn.
We're going to talk about plant medicines and then make you wait for it.
Okay. Big things that I see that are important are pre-planning. So if you can pre-plan, like do a bunch of batch cooking or get a whole bunch of meals prepared, even when you're pregnant, like just stock a freezer with food, or, you know, tell your family like, hey, can you help me out? Like in the next few weeks, can you bring meals over? You know, a lot of people talk about getting food delivered and all that stuff. It is expensive. And also like you need to be in the right frame of mind. And that takes a lot of pre-planning too. And I also hate like waiting for food to come. So
she gets really hangry.
I'm a very hangry
I haven't fed her
person.
lunch yet today. So she's going to get in a really bad mood at about 1 p.m. in 9 minutes.
Starting. So.
It's the reason why, you know, Dr. Catherine is bringing up food is because legitimately, I cannot even tell you how many times I've heard a mom say, oh my God, I haven't eaten yet today. And like, you've had like 5 mood swings and didn't want to get out of bed, but like you're saying you haven't eaten or drank water yet today. And it's like, you have to actually give your body things to thrive on for you
Yes.
to thrive.
And
So
also, not eating causes blood sugar dips, and that can also cause anxiety, or at least similar symptoms to anxiety. So you might be having a low blood sugar dip and think, oh my God, this is an anxiety attack. No, you just might have to eat.
yeah.
So,
Or like, oh my God, I hate my baby. It's like, no, you just can't handle the crying right now because you're hangry.
yes.
Yeah.
Oh my God. Okay. So,
Relatable.
um, okay. So pre-planning, trying to do as much as you can, before the baby is born, when you're in a better state of mind, getting your family on board, getting your friends on board, getting yourself organized if that's possible, having a routine. So making sure, you're waking up and like making your bed, or you're having water in the morning, or having breakfast, or having meals, eating food.
Regardless
Yes.
of how you feel.
Yes. Yes. Thank you.
Non-negotiables.
Yeah. Yeah. Showering. Make it a thing. Like, get some essential oils, take 10 minutes, make it like a spa like experience. Like, these are little tiny things that you can do that might sound like trivial, but make a world of a difference when you're just in a crazy ass
Whirlwind,
state.
yeah.
Oops, crazy state.
Stop swearing on my live.
Yeah. Okay, so routine, rituals. We can add like journaling, meditation into that.
I want to talk about journaling.
Okay. Also,
let's do it now.
Hold on.
Remember what I said about her getting hangry?
It's happening.
No, it's happening. 7 minutes out, guys.
Okay. Rituals, routines, pre-planning, getting your family on board, support, making sure you're communicating what is going on, whether it's with a trusted friend, your partner, your mom, your dad, your family, your brother, sister, somebody. You need to be in constant communication.
Just not your dog. Don't talk to your dog. They won't be able to help you.
They won't help you, maybe a little bit, but they won't know. That is very important. And figuring out some sort of system, because people around you will be able to see like when you start going downhill.
Objectively.
If you're going downhill, if you're just having a bad day, if you need to up your self-care, like when you're in it, you're blind. You're just like, this is a shit show. I'm going to die. I hate my life.
And no offense. This isn't us being like, you don't see yourself as you are.
Us going through it ourselves.
You are not a good marker of objectivity when you are a subjective character in your story. And that's why when I work with people, I try and teach them objectivity and how we perceive ourselves, but we have to have people around us as checkpoints. Like when you're working on your mental health, you are not an objective measure if things are getting better or worse, more than someone else is watching you.
Any health that you're working on. It's like, no, I didn't make any changes. There's no things that happened that have been positive.
Nothing's helping me. I'm not getting better. It's like, meanwhile, everyone else around you is like, you're like way better than you were 6 months ago. Okay. So journaling for objectivity. Okay. If you are someone who likes talking it out to other people, great, fine. But looking at your writing and what you're saying, if you're having intrusive thoughts, if you're having, spiraling anxiety attacks of things that are happening inside your head, write them down. You can be an objective third party when you read your writing. Okay. So if you journal every single day, if you're like, okay, I have a vulnerability to getting postpartum anxiety and depression, and I want to make sure that I stay on track because I like having control and I want to know about myself, journal every single day. Just free form. Just write about how you feel, write about what's going on, write about all the nasty thoughts that are happening in your head, write about all the amazing thoughts that are happening inside your head, get them down and watch yourself every single day. Right. Go back after a week and read. You can see how your thoughts are shifting. You can actually catch a decline in your mood and your behavior without someone externally saying something if you are journaling objectively. Okay. And don't journal to lie. Tell the damn truth in that journal. Say the nasty things that you need to say. Yeah. Because you have to be able to observe yourself without judgment. And then someone else will be able to receive you without judgment. And that's one of the best skills I've ever learned about myself, is I think that I am brutally honest with myself, and it makes other people, like when I say something to you about myself, you actually hear it and you're like, whoa, it's almost like jarring for you to hear how honest I'm being. And then you're like, yeah, you're kind of right. And I'm like, okay, cool. I'm like, it to validate it. You're like, okay, but you write it down. Okay. It's an amazing skill.
Also, it helps you get that emotion out of your body. So you get it out of your system, and sometimes you just need to get it out. Like sometimes you just need to get it out of your system, see it on paper and be like, yeah, that's kind of messed up. Or yeah, I am kind of feeling like that. And then you can what's the word? Like acknowledge it,
Yeah.
name it,
Yeah. Label.
and tame it.
Yeah.
Name it and tame
I
it.
like that.
I didn't make that up. Some other psychiatrist. Yeah.
So also what that's helpful for is when you decide after 6 weeks, 8 weeks, 4 months, you're like, we're not doing too hot over here. Now you have information
Totally
to give to someone else.
Yeah.
Okay.
Data.
Like when I start working with someone, I don't want to hear what your rendition of your story is. I want to know actually how you were feeling at these different points and like be very honest about it. And see how things have changed over time and how your perspective has shifted. Giving someone your journal, like when I work with people in Peace of Mind method and I make them do the journaling, I'm like, so do you feel comfortable sharing any of those with me? Right? Because we want to know what's happening inside your brain, how it is shifting over time for the better or for the worse. And then you can start intervening and seeing how things are changing. So yes, writing, amazing skill. I also mentioned having someone on your team who is not going to judge what you're saying. You want to be able to bring this information to someone and for them to go, okay,
that's normal.
Yeah, not right. Yeah. Like that's the worst. Imagine you're like, listen, I'm having intrusive thoughts about hurting my child, and someone goes, right? Yeah. It's like, oh, right? It's
yeah, and then the shame spiral starts, and you're like, oh my god,
yeah. like just receive it, but find someone who is going to be neutral with you.
And who understands that this is normal. This is part of your journey.
I mean, it's normal that it can happen. It's not normal to think that way. It's normal that it can happen.
Well, it's normal that it can happen, that you have these thoughts, but it doesn't mean that like
you're crazy.
You're gonna, do some crazy thing.
Yeah, it's not true. And I mean, I don't want to get into
just a thought.
I don't want to get into that sticky conversation where your thoughts are not you, because your thoughts are you. I don't want to throw you off into a loop right now.
Yeah, let's not get philosophical.
But some of them are pathological, and to sit with someone who goes, yeah, okay, that is screwed up and let's talk about it.
Yes.
That's where you want to be. Okay. The routine, like you were mentioning before, amazing. Non-negotiables. Okay. You need to build your day and say, maybe not even just for 10 minutes, maybe you get an hour walk every day. And that's your time by yourself. If you have someone there to watch your kid, or you put it in the stroller and you go and do what you need to do. You put it in the basket and you go. But yeah, or like strap the baby to your chest on an ergo baby. You're gonna have to do things for you. And you think that your kid, oh, they might not like the noise. It's like, no, they're ready for the ride. They've been living inside you for a long time. They're fine. Okay. Like imagine like you're a mom who's like working out while you're pregnant, and then suddenly you give birth and you're like, oh, my baby, she doesn't want to be lifted or like moved, or you're fine.
They like the noise.
Yeah, like get out there and give time back to yourself. Yeah. That's really all I can say is like, you do have to have some component of like selfishness, not in a bad way, but putting the things that you need in place. Like when you need to, let's say you're practicing meditation, that is like pivotal for you to maintain your mental health. Maybe you meditate and put your baby in the bassinet and you're laying there sitting, but maybe, maybe your hand is resting inside of there. And that's where your meditation spot is, because you don't want your baby to feel like it's being neglected while it's crying. But you don't leave your meditation because your baby's crying. Just because a baby's crying, it doesn't mean that it has to, it peed or pooed and you have to change it, and you have to pick it up, or you have to do anything. It's like, no, right? Exist with your baby. The same type of support that you'd want someone to be with you. You want them to exist with you, right? Imagine someone was always trying to change you and make you better. You'd be like aggravating, right? Sometimes you can just be there. Playing with Otis?
No, maybe.
All right, vote if you want to see Otis.
Also want to say, I know we're like throwing all these things out for you to be doing, like you must do this, you must do that. I think it's important to take it step by step and to try. If you're feeling super overwhelmed, things are crazy, just try one thing and try your best to start like implementing as many things as you can. But
cue Dr. Catherine being a compassionate doctor right now.
Jenna's like, you must do this. I'm like, well, let's just see. But yeah, I understand overwhelm. I understand when there is a to-do list that is like miles long and you're like, holy shit, I can't, holy crap, holy cheese.
I'm gonna get canceled.
I'm so sorry. You're like, oh my gosh, I can't even get out of bed. And I'm supposed to be doing all these things. So just take it step by step. Choose one thing. Choose one thing that's really important, like eating every day. staying hydrated, taking showers, the basics, and moving your body. And then start building. And then also reaching out to, other doctors, other support systems that can help you out to get you through the difficult phases.
Yeah. Let's quickly go back to the plant medicines because we gave the teaser and then we've already been live for an hour.
Okay.
I told you we weren't going to be able to stop talking once we started talking. We're going to do this quick. Okay. Because again, this is not medical advice. We're never saying, hey, this is what you should take. We're not your doctors, unless we become your doctors. So that's always an option. Yeah. But let us talk about some of the plant medicines that are helpful. Okay. Like we already said, if you are online, you're going to get a lot of fear-based information. I saw Caitlin leave a comment, do not Google. Okay. You've been warned. But don't go on Google because you're going to get a bunch of information that is completely biased and related to and based on the information that's available to us, which is literally null. We do not have good enough information in the plant medicine department, but just remember that if it's okay to take an SSRI while you're pregnant and while you're breastfeeding to benefit your mental health, why does the same rule not apply for plant medicines? Okay. So we do have to take everything with a grain of salt. And we are going to talk about a few things that we know we can take both during pregnancy and breastfeeding. And if not breastfeeding, obviously, if you're not breastfeeding, it's a free for all. Okay. You can take whatever plant medicines you want within reason, if you have a diagnosis, we talk about that. Yes. If you're my patient, we talk about that. It's not actually a free for all. I'm saying as a prescribing doctor, it is
you're less restricted than if you're breastfeeding.
Yes. Because there's tanks. So St. John's wort, a lovely plant medicine that has gone ton of research put into it because it is so similar to an SSRI from its mechanism of action. Okay. You can take that while you're breastfeeding. Fantastic. You can take it while you're not breastfeeding. Fantastic. If you can take an SSRI while you're pregnant and St. John's wort works well for you when you're not pregnant, why not stay on it? Okay. That is my non-medical advice statement for today. Okay. Another plant medicine we looked at lemon balm today. Okay. That's Melissa officinalis. That's the official plant medicine name. But we use that for mild anxiety and mother's anxiety. Okay. It's also really good in kids because it's nice and gentle. So if you are breastfeeding and you've got an anxious, like rifling baby, maybe it's going to be very helpful. Also has a side benefit to digestion. So that might also be helpful in breast milk.
Yeah.
Interesting. So lemon balm, nice to look into. Okay. I know we mentioned chamomile before. Great plant medicine. Do we sometimes have allergies to it? Yes. Obviously you want to work with a doctor because it does belong to a plant family that does show allergies sometimes. Are we talking chamomile tea? No, not really. We do want to look at, the bioactives in the plant and using it in an encapsulated version or tincture version, whatever is your thing. I'm not big on the medicinal tea unless it actually has a dose. Like when I'm sick and I take the traditional medicinals with a dose, you have to be getting the therapeutic dose for a plant. And I think that a lot of us think, oh, it's natural. I can buy it at Shoppers Drug Mart or CVS if you're in the States or something. No, buying chamomile tea is not going to it's not going to not help, but it's not going to make this dramatic difference to your postpartum anxiety.
You got to boil the out of it. Yeah. It has to be boiled.
Did you just blank your own SHIT out?
Yes. So that you're getting a really, really, really strong infusion, and then maybe you might get some benefit.
Yeah. Something else we talked about earlier about, progesterone dropping and estrogen dropping. We have a lovely plant called Vitex. Vitex cactus, Agnes cactus.
Agnes
cactus.
Cactus. Agnes
Vitex. Okay. This plant is going to be a progesterone modulator. Okay. Really helpful in PMS or really helpful in PMDD, really helpful in postpartum conditions. If you are not breastfeeding, okay. If your progesterone is tanked, we are going to have to build it back up. And we do like to use that plant because there's a lot of research on it. So if you are feeling that the anxiety and the depression is very hormonal, even if you're not recognizing it, it's something that we want to treat just to bring you back to a place of hormonal balance after you've gone through this a very fascinating period of time. Something else that I looked at today was also passion flower and valerian, because it's something that's really good for anxiety in people, generally I prescribe. But I wanted to know if it did have a reaction through breast milk to the baby. And I guess the best advice that I could ever give, but not a medical recommendation, is if you're going to take something that is going to reduce anxiety by causing a little bit of a sedation effect, just keep an eye on your kid. Your kid's not going to like pass out and never wake up, or like you'll notice, are the nap schedules changing? Is the energy level not there? Is the engagement during feeding not there? Those are things to look at. And I think that you don't need to be so afraid of them, because you can observe. You're a mom, you have spidey senses. Okay. So if you want to take something to benefit your mental health and it benefits your child because now they're like less, let's call it restless, or like less uncomfy, then why not take it? That sounds like a good jig. Something else that I was looking into today as well in prep for this was, what plants do we have that affect dopamine? Because dopamine can be very low when progesterone is low, and dopamine is our reward hormone. So it's like, do I want to get up? Do I want to go do that thing? Is there any feeling of mastery when I do that thing? And if dopamine is low, we can use some plants to stimulate that to being released. And one that we looked up today was Mucuna purines.
Yeah, purines.
Yeah. So that increases dopamine and it increases motivation. Is that something that you should just go jump on and go do? No, I'm just saying we do have plants that are going to regulate dopamine. We have plants like curcumin, which is an anti-inflammatory, but it also does affect the dopamine pathway. Maybe that's going to be better for your treatment plan, right? So we do have all of these little dibs and dabs and tools in our toolbox to use, that we don't have to rely on pharmaceuticals to get us there. And we also don't have to just raw dog it and not take anything and suffer. Like you can take different things to help move your neurotransmitters in the right direction, to have that right hormonal control so that you do feel better. And at the end of the day, that's where I lean, is like, don't suffer unnecessarily, but also don't overtreat. Right? Like, obviously, if you can't get out of bed and your postpartum depression is so bad that you can't function, like, yeah, you're going to have to be put on pharmaceuticals of a very strong degree, and whatever will be, will be. And there's nothing wrong with that. Yeah. Medication is a tool. Yeah. You have to use it when it's required. Like, if you have an infection in your leg, you best be going on antibiotics so that you don't pass away. Yes. Okay. Yes. Like, medication is a tool to be used, but we want to play around with, what do we need versus what do we want versus what resonates and aligns with us and like the desires we have as a human. Yeah. Right.
You have options. That is the moral of the story. You have options, and you're not just siloed into one direction. There are a lot of options, but it's also important to be working with someone who knows what they're doing so that they can customize those options specifically for you, because there's no point in just like throwing all these things at yourself and taking a whole bunch of things and then just being totally overwhelmed, spending a ton of money and just running around in circles and spinning your wheels.
Yeah. I think more people are scared though. I think it's like less likely for a mom who's just given birth to like give herself a natural treatment protocol, because they're afraid of the breast milk, afraid of the hormones, afraid of everything. And like, you know, I guess the mainstream science and the media has done a fantastic job on you, right? So we do need to get down to that mindset piece at the end of the day and find out what's going on, what you need in order to feel right, so that we can bring you back to a place of normalcy or balance again. Because this is not a forever condition. It can predispose you to having other anxiety and depressive episodes if you don't work on your nervous system. But if you put in the work, which you've heard me say a bajillion times, then you will get the result that you want, whether you like it or not. Let me go see if there's any more questions coming through right now. Caitlin's on fire today. I like chamomile tea with honey and breastfeeding, and I most definitely use it as an excuse. No regrets, but like, no, sorry, I'm breastfeeding. I hate medication, including Tylenol and Tums. So there's that. Thanks to my little man. Yeah, I mean, there's other options for you there too, right? Hopefully you're still listening and you can respond back to that.
Yeah, and all the things we talked about before that were
right. They don't interact. They don't interact with breast milk, right? Yeah. Yeah. I mean, it's so weird. People like take something and they'll be like, oh, you know, it's going through my breast milk. It's like, okay, so is the food that you're eating, right? Like you can eat yourself into a toxic place, even eating sugars, right? Like think about that. Like you're eating whatever you want and your blood sugar is like trying to regulate itself. Your blood sugar is going through your breast milk and you feed your baby sugar. Not like that's the worst thing in the world, but like you are now causing them to have an insulin response. And now their body is having to deal with whatever it is that you ate. So let's stop demonizing things that are going to help us. And then say, well, I don't want to affect my baby. It's like everything affects your baby. Do you fight in front of your baby? Do you yell in front of your baby? Like that affects your baby too. It affects their nervous system. So there's just like so much, again, nature, nurture that goes into this. So stop pigeonholing and saying, you know, that's what science says and that's why it's good and that's bad. It's like, you have to do what feels right.
Yes.
And that is where I'm going to leave this conversation for today, because you're hungry.
So hungry.
I'm hungry. We talked about lunch like 3 hours ago.
Yeah,
about what we were going to
order
eat. I know, you're right. All right. So we're going to leave you with that today. I hope that you enjoyed this conversation, and that you learned a little bit. And if you have questions, feel free to, when that live gets posted to the Facebook group, just add your questions and I will take them as I go. And I'll tag Dr. Catherine if, you know, it's more of a her question versus a me question. Just so that you're aware, she specializes in fertility.
Yes.
So that is why
Fertility
I brought her on for hormones, because again, I was going to say I'm the brains and you're the uterus.
I was just about to swear, so.
Just like fertile, right?
I am so
Yeah.
I will be the uterus. My ovaries are here.
Okay. This has been a splendid chat with everyone. Again, if you have questions, send them my way. If you want to talk about specific stuff afterward. Oh no, we didn't get to talk about melatonin.
Oh, that's 2 minutes. I feel like we can cover it in 2 minutes.
Oh, okay. Well, let's just, okay.
Melatonin.
Okay. Guys, if you're having sleep issues, you're going to have to re-regulate your sleep cycle using melatonin, but make sure you use a physiological dose, which is very, very low, like below 1 milligram low, because melatonin is going to be passed through the breast milk and it is going to have a direct impact on hormones and presentation inside your baby. Okay.
Because it is a hormone.
Yeah, it is a hormone. Melatonin is a hormone. You do not want to be taking this like you're drinking water.
Yeah. So you should be taking it with practitioner.
Yeah, take it with a doctor and make sure you're doing it properly. Make sure you have the right dose that's going to be working for you, especially if you're breastfeeding. But that is going to make a huge impact on your sleep and wake cycles. And melatonin is going to work directly with cortisol. So if you have anxiety and depression, your cortisol is going to be dysregulated. So we do have to work in both directions. We can't just look at one hormone and ignore another. So that is, I guess, the close notes of what I wanted to bring up today. And I think someone asked a question about sleep. What's sleep, right? Yeah, we're going to have to talk about that and how to treat that, because you do have to get your sleep cycle back on track. Yeah. Okay, that was the biggest PSS segue that I did of the day.
But we did it.
Yes, I hope you all have a lovely, fantastic day. If you want to reach out, you know where to find me, and I will give you a big peace sign from here.
Bye.
Ciao. Oh, you're still recording on here.
Oh.